Okay, hi, this is Dr. Niels, and one of the other things that I forgot that you guys have to do is meds through a CVP line. So we're gonna go through that in a minute, and we'll load this per the Facebook way of Rachel the videographer and Zach asked for backup. So, so when you give a med, of course you'd want to know what the med order is, if that patient's allergic to that medication, okay? So for this demo, we're going to have these sterile water vials that say Lasix 40 milligrams per 4 mLs on it. Our order is going to be for 20 milligrams per ml, or 20 milligrams. So doing the math, how many mLs would we give?
2 milliliters.
2 mLs, okay? So that's what we're going to want to drop for our dose.
Okay.
Also, when the person's on Lasix, what is Lasix?
It's a diuretic.
It's a diuretic, awesome. And so whenever we give Lasix, what is our main vital sign that we're concerned about?
Blood pressure.
Blood pressure. So you never want to give Lasix quick. You want to give it, the normal rule is 1 minute per 1 ml.
Okay.
So we're going to want to give this medicine over a minute or 2 minutes because it's 2 mLs, okay? So we also have, when we want to make sure that our CVP line is patent, so having checked to make sure the dressing's intact, that we have a good blood return, we're going to drop this medicine in our med room. So we're going to clean off our vial. We're going to get our syringe, always a 10 ml syringe when you're giving meds through a CVP line or a port or any inserted line like this because of the pressure. If you give it in a smaller syringe, it's going to blow your line.
Okay.
Okay, so we're going to draw this back to that 2 mLs. Inject that air into your vial. Push it in. Bring it back. Okay. And then if you guys have given meds like this, you know you got to be careful so your thing doesn't go flying across the room when you're tapping it, right?
Mm-hmm.
All right. So because we're going to give this through a line, we can go ahead and cap that.
Okay.
Okay. All right. So we got this. Now, if you're drawing up other meds in the med room, it's always good practice to even label this, put the patient's room number, their initials, and how much medicine it is, like even a piece of tape that says JS room 24 Lasix 20 milligrams. So that way you know, because a lot of times if you guys haven't already, sometimes there's a lot of different meds that you're giving through their IV. So knowing which one and then remember how long or how fast you got to push it. Does that make sense?
Yep.
Okay. So we're going to bring this into the room. We're going to bring our flush into the room. Introduce yourself, of course, to the patient. Then we're going to give them some medicine through their CVP line. Always, 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 before you give that medicine, I don't care if you did vitals at 6 in the morning and now it's 8. Don't go by that 6 o'clock blood pressure. Take a blood pressure right before you get this medicine.
Okay.
Okay? Because that blood pressure could have dropped in that 2-hour time frame. Does that make sense?
Mm-hmm.
Okay. So we're gonna say their blood pressure is 140/90. You can either use the blue or the white port. Okay. If they already have fluids running through this one, leave that running. If this one's empty, use this one. Okay. Always remember to listen and report. Are all of these even patent? Okay, because the longer the people have them in, they might start clotting off. Okay. So we're going to choose the white one for now. So we take our little green cap off the end, wipe our syringe, or wipe our floor lock, and also I'd want 2 salines, one for before and one for after.
Okay.
Okay. So then we're going to draw back, check for that blood return. Okay. And you don't necessarily have to give the whole 10. You can just give 5. Okay. All right, so we want to get that. Okay. Then get your Lasix. Okay. We're going to connect it.
Mm-hmm.
And that's when you'd start that clock, right?
Yeah.
So watching that time, giving that Lasix. Is our line leaking?
Yeah.
So would we want to give meds if our line's leaking?
No.
No. So we would have to stop and call that surgeon and find out why this darn thing's leaking, right? All right. So we would give it over the 2 minutes, okay? When that 2 minutes is done, we're gonna clamp it, Okay. We're going to use a new alcohol pad. Scrub your hub, 10 to 15 seconds. Then we're going to use our new saline and flush it again. Now, if that person is getting other stuff through this line, then we're just going to use saline to flush. If they're not, then we would want to heparinize it.
Okay.
Okay? We're going to go ahead and clamp that. Okay? Good practice, and it's kind of hard to remember, but with that, giving that Lasix, we want to educate our patient, don't get up real quick because it can bottom out their blood pressure, make them dizzy, and recheck that blood pressure like in a half an hour. Now, as nurses, you're going to figure out pretty quickly. Sometimes that half an hour goes by quick and you're like, oh gosh, I didn't get back in there, or tell the CNA to check that blood pressure. So an hour's okay, but we want to make sure that it doesn't start dropping. So a half hour is best practice. Okay? And then you would chart that you gave that Lasix. So of course, when you pull up that EMAR in the room to scan your med even before you even give it, it's gonna bring up their last blood pressure. It's also gonna bring up their last labs. What labs are affected by Lasix? Potassium. So when that pops up, so you're on the EMAR and you go to scan your patient, scan the med, and it's gonna pop up their last vitals. So if their blood pressure already was like 80/50, would we give the Lasix? No, we'd wanna hold it. When it pops up their labs and it says their potassium's only 2.2, are we gonna give the Lasix?
Yeah.
No, not right now. And so then alerting that healthcare provider that ordered that and go, do you really want this Lasix right now because their blood pressure is low and their potassium's low? And they'll probably be like, oh, let's give them potassium rider or potassium pills, get that up, and let's try to do this later.
Cool.
Okay? But those are the biggest things, and that's a lot of the things that we miss as nurses, like following up those critical pieces of what were the last labs, what were the last vitals. Okay, does that make sense?